Our dogs could potentially experience a wide range of situations where they may be placed in an uncomfortable position due to their direction of purpose. For instance, when visiting an SEN school or interacting with children with disabilities and additional needs, a child may come across as heavy-handed. Our dogs are taught not to react as a typical dog may to these experiences. For example, if it gets very uncomfortable, one of our dogs may just get up and remove themselves from the situation rather than reacting with fear. Of course, some of the manipulation training works well with other therapy training, such as deep pressure therapy. If the dog's already used to close contact, it makes additional training so much easier, as you already know how your dog will react and do not need to sort of start again with the new training. We regularly desensitise the dogs to tail pulling, pinching, heavy-handedness, blowing, whistling, noises, ear pulling, lifting their limbs, etc., as we don't want our dogs to react in a negative way. These activities are all in close contact. Desensitisation to external distractions is covered in another video. When in a situation where these behaviours are expected, the handler therapist takes a major role. It's important to attempt to minimise these behaviours and instruct the person that it's not the way to progress. At Bale's Buddies, when initiating close contact therapies, our dogs are always accompanied by a qualified handler therapist 100% of the time. It goes without saying that we encourage our dogs to be cuddled and hugged frequently, as this is known to produce oxytocin, the opioids, adrenaline and serotonin. So all of these great reward chemicals and anti-stress chemicals can be released in both you and your dog. Your heart rate comes down, your blood pressure comes down, your heart rate variability, which is the ability of the heart to respond to stress, improves also.